One perhaps unrecognized area of looking at diabetes and risk is the area of vitamin D levels. Now, at first glance, it may not be obvious why that's important, but there is lots of published evidence that actually there is an association between both type 1 diabetes, which is insulin dependent, and type 2 diabetes with levels of vitamin D. So in other words, if your levels of vitamin D are low, then you have more propensity to develop certainly type 2 diabetes. The other thing is that in my own clinical practice, I'm finding, as I routinely test vitamin D levels, is that 70% of clients who come and see me are actually deficient or below the recommended level of what vitamin D should be in the bloodstream. So vitamin D helps to regulate over 2,000 different genes, and the list of what it does is extending year by year as more research is done on it. One thing I can tell you, if you're diabetic, you cannot afford to have low levels of vitamin D, and hence why we include vitamin D testing in the programs that we offer at Bindon House. And it's important to get your vitamin D to an optimal level if you're going to look at a complete program of reversal. One area that's perhaps unrecognized in terms of management of diabetes is the area of using food supplementation. I'd like to share with you some research that a colleague of mine performed in the Czech Republic. His name is Dr Michael Kucera. And he conducted a study on 65 people who were over the age of 65. Now, these people had to have two diagnoses. They had to have type 2 diabetes and also high blood pressure. They also had to be on 1 or 2 medications for both diagnoses. He then put them on a supplement which was a combination of key important cellular nutrients for a period of 14 weeks. Let me share with you the results of his study. After 14 weeks, 12% of the people in the study were able to discontinue all medications. 15% were able to discontinue 2 medications. 23% were able to discontinue 1 medication. And 40% of the rest were able to reduce their doses of their medications. Now, I'm not aware of any other study which has demonstrated in such a short period of time such profound reversal, if you like, of a disease trend. In this case, we're talking about type 2 diabetes and high blood pressure. So, when you come to Bindon House, part of the overall assessment that you will have and part of the therapeutics that you will have are to address how we can use key supplementation to enable you to move in the right direction. That is, away from having diabetes in the quickest possible time.